We're back in Rockville at Center for Vein Restoration with Dr. Fernandez, and always great information, and we always learn something new when we're out here. Today we're going to talk about a DVT. So what is a DVT?
So DVT stands for deep venous thrombosis, and it is a blood clot that forms within the veins, most commonly of the legs. And it is of concern because these blood clots can break off and go into your lungs. This is what we hear as pulmonary embolism. It's what we hear as in the airport, people unfortunately from long travel and mobility, having this formation of DVTs and then developing this pulmonary embolus, which can unfortunately be deadly.
And we hear about these stories, but how common is it?
Oh, extremely common, unfortunately, and it often goes undiagnosed. There are multiple risk factors for blood clots. Family history is always most important, but medications can do it, so like birth control, obesity. One of the very common conditions that can bring on blood clots is chronic venous insufficiency, when the blood pools in the legs because insufficient veins. We usually see this as varicosities. And though we think that they are benign and a cosmetic condition, it really actually increases your risk factor of a DVT by 3-fold. So it is important to obviously be aware of the multiple risk factors and take care of it.
Yeah, and let's talk about getting checked and how people can come here to Center for Vein Restoration and why it's important to get checked.
So obviously important because you want to make sure that if you have a blood clot, you catch it earlier. The earlier the better. Prevent that pulmonary embolism from developing. You also can develop other complications from not having it treated, such as chronic swelling, what we call post-thrombotic syndrome, and you can even develop chronic venous insufficiency. So it's very important. We diagnose it using an ultrasound. In office is a very simple test, which usually lasts about 15 minutes, non-invasive. The ultrasound looks at the veins, and we find the thrombus that way. When it's identified, then we can start the appropriate treatments, which is commonly blood thinners. It's different kind of medications that help thinner blood, so that blood clot can break down.
Can you explain to me how CVR can help?
Yeah, so CVR is actually the largest provider of venous care, and we specialize in the management not just of chronic venous insufficiency, which is a major risk factor, but also the diagnosis and the treatment of this blood clot. So any of our clinics are staffed with registered vascular technologists, which are at the top of their training for the diagnosis and management of this condition.
And there are locations all throughout the DMV to visit the Center for Vein Restoration or Dr. Fernandez right here in Rockville. Always great to see you.
Great to see you. And one more thing is March is DVT Awareness Month. So I really want our viewers to really be aware of these risk factors and their conditions so they can take care of themselves appropriately.
Get checked, make that phone call.
Thank you.
Thanks so much.
Good to see you.
Good to see you.